Good morning, everyone. Welcome to Catholic Community Services monthly webinar. My name is Terrance Watkins, and I am the Executive Director of Housing and Medical Respite Services for Catholic Community Services. I'd like to remind everyone to please make sure your microphone is on mute. And when we get to the end of the presentation, we will open it up for questions. For today's webinar, the agenda is we'll review a brief program history of transitional housing. I'll give you a little bit of information about the program outline, some key opportunities and the future vision, how you could possibly support this mission, and then we will open it up for discussion. So I wanted to introduce the team, and unfortunately, I'm the only one from my team who could make it today. But as I said before, I'm Terrance Watkins. I'm the Executive Director of Housing. And then there's Helen Sanchez, who is the Associate Director. She can be mainly contacted for anything related to our transitional housing, our home buyer program, housing support services, and any of our HUD-funded programs. And then there's Michelle Torres, who is the program coordinator too. She also oversees all of our senior housing program, and she is the property manager for the transitional housing program. Okay, so to provide a little bit of history about transitional housing. The United States Department of Housing and Urban Development used to be the primary funder for transitional housing programs nationwide. In 2009, HUD began reallocating the funding from transitional housing to support rapid rehousing program. This model, that is rapid rehousing, it only prioritizes individuals and families that have been homeless for a long period of time, and it does not provide any assistance for families that are newly homeless or are constantly struggling with housing instability. Catholic Community Services wanted to create a program that could rapidly respond to these needs and provide immediate, short-term assistance to families to help them rapidly transition out of homelessness and achieve housing stability. So a little bit of historical. And Catholic Community Service established the Casitas Esperanza de Concini Transitional Housing Program in 1988. CCS utilized the property over the years to provide a variety of housing supports to families in need. In 2022, CCS was able to secure funding through the Bezos Day One Foundation to complete critically needed updates and renovations to the property. With the Day One funding, CCS was able to paint the units, replace and repair doors, upgrade the cooling systems and evaporative cooling to air conditioning, install new floors and cabinets and fixtures. In May of 2024, CCS began implementing a new model of providing support services to assist program participants successfully transition from homelessness to housing stability. So, what is it that we do? With the renovation completed, this was the question that was posed. Yes, we put people in housing, but what is the program that we are actually facilitating? We provide an apartment to families, but what do we actually do to help resolve their situation? As one of the few remaining transitional housing programs in Pima County, we incorporated the following services into the program to help our residents achieve their goals. Assessment, we wanted to make sure that we were doing a comprehensive assessment for every member. Individualized service planning, supportive housing services, financial literacy, and coaching. So for assessment, CCS completes a comprehensive person-centered assessment with all program participants at entry to identify social determinants of health, such as income and employment, education, mental health, and social engagement. CCS will also assess cultural preferences to ensure services are respectful and responsive to the diverse needs, beliefs, and practices of our participants. With individualized service planning, CCS will work with the participant to create a service plan to address their social determinants of health identified in the assessment. The participant will work with their housing specialists to address these concerns and the service plan will be updated as goals are achieved. So, supportive housing service. Each family will be assigned a housing specialist that will work with the family to achieve the goals that are identified in their service plan. Housing specialists will provide referrals to vocational services, assist with identifying training opportunities, train participants how to complete a free application for federal student aid and enroll in school, establish and attend medical and behavioral health care appointments, develop positive social support systems, and any other tasks needed to assist the participant in achieving long-term stability. Now, financial literacy and coaching. The participants in transitional housing receive a monthly subsidy of $704 toward the cost of their rent. That decreases their rent from $1,250 for a two-bedroom apartment down to $546. As a requirement of the program, participants are required to attend financial literacy classes once per month. This will teach the participants the basics of personal financial management, as well as explain taxes, interest rates, and loans. Additionally, participants are required to meet with a financial coach. They are required to save 10% of their adjusted net income and pay 10% of their adjusted net income towards the balance of debts identified in their credit report. They will also meet with their financial coach monthly to review their budget. As far as what is an adjusted net income, we all understand that we get a gross pay. That's not what you actually receive on your paycheck. And then after you pay your bills, it's not quite the same either. So when they work with their financial coach, we will help them create a budget, and all of the money that is left after they've paid all of their bills, that is their adjusted net income. So they will be required to pay 10% of their net income towards bills and save 10% of their adjusted net income. So program outcomes. Why do we have them do it? CCS has a home buyer program that assists low-income individuals to apply for down payment assistance through multiple funders. That being said, an ideal outcome for the participants would be to increase their income, save a minimum of $2,000, and repair their credit score to have a median credit score of 640 or better. If they can achieve these three metrics, CCS can assist them with applying for down payment to achieve the ultimate form of housing stability, home ownership. For participants that are unable to achieve those metrics, or simply they don't want to buy a house when they leave their program, at least they will be able to have increased income, which will provide additional options for them in the future, save money, which will safeguard them against their return to homelessness, improve their credit score, which will give them more favorable loans in the future, and they would have already made the steps to address their medical and mental health, which will provide improved health. So the key opportunities and vision, of course, my main goal is always to increase housing stability. We can directly address the homelessness and financial instabilities of families in Southern Arizona. The second goal that I have is I want to quantify the impact of this program. Catholic Community Services will begin collecting data on the participants' social determinants of health at entry and at exit to demonstrate the effectiveness of the program. Some of the data that will be included will be highest level of education. Did you get your GED? What is your monthly income? When was the last time you've been to the doctor? Do you have a primary care provider? These we hope to be able to demonstrate that there is a clear change for a positive impact and change for each one of our participants, and that we are actually working really hard to help end homelessness. And then three, we want to advocate at the federal level for funding for transitional housing. With the rapidly increasing rates of homelessness in the U.S., CCS will advocate for additional funding to support and expand this model of housing. The overall vision is we want to positively impact the lives of the families, track and report on the progress of the participants, document outcomes to advocate for additional funding to support this model. So, how can you help? Collaboration. You can help with this mission by allowing housing specialists to refer participants to your programs, whether it's an internal program at Catholic Community Services or an external service such as medical or behavioral health care or employment, vocational. As we strive to address the needs of transitional housing participants, we may encounter someone that has a need that you are better suited to address than we are. This may range from counseling, food boxes, vocation, tax prep, etc. To work collaboratively to address the needs of CCS members will benefit us all, as well as the members. Donations. Donations such as household cleaning supplies, hygiene items, linen, school supplies for children. These are all very helpful donations. These are typical items that are not allowable expenditures in most grant contracts, and the participants struggle to acquire them. And that is it. I did include at the bottom, there are some pictures of what the transitional housing used to look like and what it's been upgraded to look like now. And at this time, I will go ahead and open it for discussion.
This is Laura. I see a question in the chat. If the client consumer is involved with DCS, can the housing specialist help transport client consumer to drug testing?
Yes, we can help transport the individuals to drug testing. But one of the things that we like to practice is we like to teach you to fish. So a better way of doing it would be to help the member identify the bus routes, help them get bus cards so that they would be self-sufficient. And this is something that they know how to do even when they leave our program. If the individual is disabled, then we would help them. If they're registered with Sunvan, we would help them schedule their appointments and transportation to and from. And if not, we would help walk them through the process of becoming eligible and getting registered with Sunvan.
Now I have a question. If they are disabled, do we help at all with wheelchairs, walkers?
CCS does have some supplies, but in large, if they are disabled, these are all allowable expenses under their insurance company. So we would absolutely help them coordinate with their insurance company and their doctors to get the necessary equipment that they need.
Is this the housing only in Pima County? What other counties have this option? I apologize if I missed that.
No worries. So the program, this model has been rolled out at the transitional housing programs in Pima County, but CCS also has transitional housing in Yuma, Douglas, and Sierra Vista, and we're opening a new project in Sierra Vista later this year as well.
How do we refer clients?
So if you I'm sure this will be sent out to everybody. The contact information for Helen Sanchez, the associate director, you would just send her an email if you're internal or external, and she could help you get the application completed and get your member on the wait list.
How many people are on a wait list now?
Right now, our wait list currently has about 13 people on it. We just went through the process of clearing it up and going through all of the old applicants who applied, verifying that they no longer need housing. And with the start of the program in May, we're as individuals are leaving out of the old program, it's opening up new opportunities. So I would highly suggest if you have a family that you think would benefit from this program, to reach out to Helen so we can get them on the wait list as soon as possible.
Laura, I have a question. If there's an emergency housing needed for, say, people with children, are there funds available to put them in an extended stay hotel?
No, ma'am, we do not currently have the funding for that. In Pima County, you would go through Tucson Pima Collaboration in Homelessness. If you looked on their TPCH website, you would be able to find resources for that. This program is only for families. I guess I should have put that in the slide. This is a program that is only for families, as we have 2 and 3 bedroom apartments. Again, we don't have the funding. It's if a family was in immediate need, we would not be able to put them higher on the wait list and bump somebody else down who also qualified but was able to stay with their grandmother for a couple of weeks while they waited to get into the program. Laura, did a new question pop into the chat?
I do see, can you speak about a client's criminal history being a barrier to them being accepted for transitional housing with CCS?
Yes, ma'am, I can. So I am a firm believer in second chances. If an individual has a criminal history, I'm not going to hold that against them. The 2 things that we cannot accept into the program would be any kind of sexual related charge, any person who is required to register as a sex offender would not be accepted into the program, and we cannot accept individuals who have charges of arson in their past. Other than that, we are absolutely here to work with you. If we really get jiggy with it, our housing specialists will be able to help you try and get your criminal convictions set aside, help you try and get your rights restored so you can vote again. That's all part of helping the services that they need to live a stable life, really.
And the question there's from Lydia, do you help people that are deaf?
Yes, ma'am. There would be, this is fair housing. We're not going to discriminate on any person for any disability, any race, gender. We're not going to discriminate on anybody for anything. If an individual is deaf, we actually do have the added advantage of referring them to CCS's COPD program, where they could get counseling, and we would work with their team to see how we can improve ourselves to be able to provide a much better service to the members. So absolutely.
Question, how would you address a client who has children in DCS placement, but with a plan to reunite?
The second part of that question is the key. If somebody applied and they do have a plan in place for reunification, and we can get a letter from their DCS case manager that confirms they're ready for reunification, the person just needs housing, we would absolutely accept that individual.
There's a question coming through the interpreter. One moment.
Okay, hi, I am Lindsay. So I do a lot of advocate for deaf, blind, hard of hearing individuals. So we have an individual, they had come here. This person is homeless, they have no home. And so I've been trying to search, for a home to place this individual. I was able to place that individual. This person was stable for 1 year. And now that place wants $200 increase on their rent. I'm just like, no. And so this, the client that I've been trying to help, that I placed them into the home, they are just nervous. What do I do? What do I do? And so, I mean, $200 increase on their rent. I mean, their income is stable, their financial situation is stable. Why did they increase $200 in a year? And so they can't buy food, they can't afford to buy food. So we're trying to, I mean, he's thinking maybe just, I mean, he doesn't, this person person doesn't want to be homeless again. And I'm just going, oh, trying to figure out all the options as far as what we can do. And I know there's the problem with backstage or something. There's a company that increases in rent. They keep on rent keep on going up. I don't know exactly how that is, but what do we do in this situation?
Well, there was a lot in that question. And not gonna lie, you're gonna get me to nerd out here a little bit. So the rent in Pima County has increased by 60% since 2020. This is one of the greatest increases in the country. You are absolutely right. The Federal Bureau of Investigations did file a complaint against several companies for artificially inflating the rate of rents as they operated the property management software, which told them what it was supposed to be, what the rent should be increased to. $200 is a very significant increase. And unfortunately, in this environment, that would really just mean that you would need to find a cheaper apartment. That being said, property values are coming down now, just a little bit, not a lot, but they're coming down a little bit. And so with the interest rates just dropped again, so we should see some relief in rents not going up. For that particular tenant, I would highly suggest that they go and apply for SNAP benefits. SNAP will take into account your income versus what you're paying for rent when they make the determination.
They have applied. They only get $20 a month for SNAP benefit because it's only one person. This person is senior citizens. They're in their 70s. They only qualified for $20 for SNAP benefits.
With their rent increasing, it will bring their essentially the rent increasing will reduce the money they have left. So that would be a direct increase in their food stamps.
Okay, I'm putting that down.
And my email is in here. I'm busy. I'm not going to lie to you and say that I'll absolutely respond on the first day. But if you send me an email, I will try and generate a list of more affordable apartments than what the person is currently living in.
Terrance, this is Laura. Do the utility companies
Yes,
offer?
please. Yes, please do that.
You got it. I'm sorry, Laura, what was that?
Do the utility companies help with discounts for the disabled?
Yes, ma'am. Well, TEP does have, I don't want to misspeak. I think it's called the Heroes program. But yes, TEP does have a discount program if you're receiving disability benefits. I might want to add that the rent for these apartments for the transitional housing, it was set based on the fair market rent, but we used the fair market rent from 2 years ago. We wanted to make sure that these apartments were affordable for individuals. So we set the rent low. That includes utilities. And we also attached the $704 a month subsidy to it to make sure that they would not only be able to afford their rent, but would have money to save to be able to work on their down payment and pay off debts.
This is Laura. Is there any support services for people who may qualify for household goods like laundry detergent, soap to wash dishes, toilet paper, these types of necessities?
In the transitional housing program or just in the community?
In general with CCS.
We don't have particular funds that would allow us to, I don't have a bucket of funding to just buy it for everyone in CCS. For the people that are in the transitional housing, we actually did budget a fair amount of money to be able to make sure that we could cover those types of odds and ends that especially food stamp doesn't buy dish soap. So we wanted to make sure that we could absolutely cover that for the people in the programs.
The question, are they able to have a support animal?
We are able to take therapeutic animals and service animals. So as long as the individuals that are coming in have a letter from a behavioral health, I'm trying to think of the actual legal term. They need to have a letter from a credentialed behavioral health professional who has intimate knowledge of the member's disability and how this animal helps them cope with that. But if they have that, then yes, they would absolutely be allowed into the program with their support animal.
Has CCS gotten the HMIS license?
Yes, we do have the homeless management information. We have several licenses for HMIS. We have one for our medical respite facility. We have one for our medical respite permanent supported housing program as well. Transitional housing is not a HUD funded program. This is a program that's funded through CCS and the Day One Bezos Foundation. So we're not required to utilize the homeless management information system for this. That being said, we are going to be doing the same kind of tracking that's similar to it to be able to ascertain a person's level of functioning at entry, midpoint, and at exit.
Other questions on the chat? One more. How long does the Bezos funds, how long is it available to CCS?
So out of the remaining Bezos funding, we've set aside enough money for the next 36 months for us to be able to support the transitional housing program statewide. And individuals are also able to unmute their mic and ask questions if you would like. Give it a couple more seconds to see if somebody has any other lingering questions.
I have a question. This is Anna.
Hi, Anna.
Hi, sorry about that. I really thought I had it on mute. Anyway, is there going to be priority for childcare scholarships for the people who are living in our transitional housing? That is for POs of childcare.
I am not able to answer that question. I can absolutely coordinate with George, the executive director over there, and we can see what kind of preference he's able to attain. But the same with our wait list, we try and keep it fair for the community. That being said, a lot of the participants that live in our transitional housing do utilize PO's childcare. It's really close, convenient to their house, and it's an exceptional service and a great program to boot.
Okay, thank you.
All
Ms.
right.
Laura, what kind of donations would help your program other than cash?
As I said before, household items, hygiene, soap, linens, bed sheets, clothing, kids' clothing, especially work clothing, furniture. The apartments that we have furniture, but some of the people choose to bring in their own. But we can almost always use furniture. And even if it doesn't go to this transitional housing program, we have several other housing options. So furniture is a really great one. Yeah, those would be the main donations that they would like. And I know they said other than cash, but if anyone would like to donate cash, we would. All right, I'm going on my little spiel. I absolutely love Thanksgiving. To me, it is a time that we are thankful for everything that we have in our lives, good or bad. And I want to make sure that we're able to give these families a Thanksgiving dinner. So cash or even Fry's or Walmart gift cards would be amazing for that as well.
There's a question, are there washer and dryers available for donated clothing?
Yes, ma'am. There are washers and dryers. There's washers and dryers in some of the units, and then we have a laundry facility. But we have plenty of laundry facilities that we would be able to wash any linen that was dedicated or donated to the programs. All right. Well, if there are no more questions, I want to thank you very much for joining us for this week's or this month's webinar. If you have any questions, when Laura sends out the PowerPoint, please feel free to reach out to me or to Helen or to Michelle, and we would be more than welcome to answer any questions. Wait, I just seen two more things pop in the chat. Are those questions, Laura?
They are thank yous for an excellent presentation.
Okay, thank you. And please feel free to reach out to us if you have any more questions that come up afterwards, or if you wanted any more information regarding the program. All right, I thank you very much for joining us. Have a good day.